If nurses were able to have a more sustainable structure for them to spend more time with patients, and we could actually provide preventative care rather than reactive care, when nurses have that dedicated time to help provide that teaching, that we could start to see like downstream effects on the patient's outcomes, right? And we're just not good at that in the US. That preventative care is really not that preventative.
What are you most excited about when it comes to nursing, especially now in this tech space?
I think the most exciting thing for me is that I think there's more awareness that there are more options, right? Even just for the nursing community. I was in college as an undergrad student and I wanted to just volunteer. So I happened to take a shift at the Children's Hospital at Vanderbilt University Medical Center. I got to see a glimpse of what the nurses were doing for them at the bedside. And pediatric nurses are a special breed. I feel like they obviously not only do they take care of like the clinical needs of the patient, but you have to engage with them and be fun and build their trust. I saw the nurses doing that on the floor and I was like, wow, like that is cool. I want to do that. And so I made that pivot. I was like, all right, I got to figure this out. What is it going to look like for me to go to nursing school?
I've had the most fun working as a pediatric nurse practitioner, just in love with those children and their care. And people say, oh, it takes a special person to want to work with kids. And I'm like, no, it takes a special person to want to work with adults. Welcome to the Nurse on Purpose podcast, where we challenge media stereotypes about nursing and spotlight the incredible and diverse roles nurses play in healthcare. I'm your host, Nello. Every week, I'll be joined by a nurse who is reshaping the narrative. From frontline care to leadership, education, innovation, and beyond. Our aim is to show the world that nursing is so much more than what we see on TV. Together, we'll explore how we can collaborate with media and other stakeholders to create authentic and inspiring portrayals of nurses. Let's begin the conversation and ignite change, one episode at a time. Hey guys, welcome back. Today on the Nurse on Purpose podcast, we're joined by the brilliant Mirini Kim, Chief Nursing Officer at Pocket RN, passionate educator, and co-chair of the Commission for Nurse Reimbursement Business Committee. Mirini is at the forefront of reshaping how nurses are valued, both in the clinic and on the balance sheet. With a bold voice in virtual care and a heart for education, she's pioneering solutions that honor the skill, soul, and science of nursing. Mirini, you're welcome to the podcast.
Thank you so much for having me. Excited to be here.
So let's get started. I want to touch on really just the beginnings of your journey as a nurse. You know, we've talked about it before, but I want you to share with my listeners about how you found nursing or how nursing found you, what the parental influences were, and what the path that you originally were looking at before you landed on nursing was.
Yes, no, I'd be happy to share that. So yeah, nursing was definitely not on my radar growing up. So if you were to ask me as a child, you know, what do you want to be when you grow up? There were lots of different things. At one point I was like, I want to be a singer. I want to be a teacher, like all these different things that came up. But one thing that stuck for a while was the teaching aspect. I said that kind of had a longer season of my life. And then there was a point in time where I said, oh, I think I want to be a child psychologist. And it was always kind of this passion for working with children and helping them in some way, shape, or form. So that kind of thread has stayed the same. But nursing wasn't on my radar, actually. And I think part of it was also, you know, I'm the child of immigrants. And so when my parents came to the United States, they were in high school. And it was a new language, new culture. And there was a lot that I think they felt like there was a lot of opportunity available, but there were also still some limitations just because they didn't have kind of that baseline understanding of the language and things like that. So being in the US around that environment, I think what they really wanted to was establish roots and allow for stability for their future life, for their future families and things like that. So when they envisioned my future or even my brother's future, I think think they wanted to stick with what they knew, right? The things that they knew were like safe careers. There was a
Right.
trajectory that they understood. There was some stability in that sense. So, the typical things you hear are like, teacher, doctor, lawyer, like, things that have some sort of respect and prestige that require,
Mm-hmm.
a amount of studying and
Mm-hmm.
expertise in that area. And so
Mm-hmm.
that was kind of what they knew. So the teaching one
Mm-hmm.
was kind of like, oh, she's interested in that. That's great. So that seemed
Yeah.
probably for my parents the most like plausible career path for me.
Right.
And then I was in college as an undergrad student, and I wanted to just volunteer and my time and see what else was out there. So I happened to take a shift at the Children's Hospital at Vanderbilt University Medical Center in their playrooms. And so they had these volunteers that help clean up the playrooms. If there are patients that come in, you find activities for them that are age appropriate, that they physically
Yeah.
can participate in, all that kind of stuff. So I did that as a college student, and I had so much fun, not only interacting with the patients, but I got to see a glimpse of what the nurses were doing for them at the bedside. And pediatric nurses are a special breed. I feel like they
Yes. Thank you for
obviously,
saying
yeah,
that.
I know I have a soft spot. That is, I mean, spoiler alert, that was what I went into. And
Yes.
so,
Same here.
yeah, it's just,
Mm-hmm.
not only do they take care of like the clinical needs of the patient, but you have to engage with them and be fun and build their trust. And kids come in all shapes and sizes and preferences. And you have to find like, okay, how am I going to win this kid over? Like, how are they going to find me as like a nurse they
Mm-hmm.
trust, that they are going to
Mm-hmm.
open up to and play with? And so
Mm-hmm.
whether you end up, talking about anime because that's what they like, or talking
Mm-hmm.
about their favorite Disney character, you have to kind
Mm-hmm.
of adapt and find your
Mm-hmm.
in with them. So
Mm-hmm.
I
Mm-hmm.
saw the
Mm-hmm.
nurses doing that on the floor, and I was like, wow, like I can see like these complex drugs that they're hanging, and
Yeah.
clearly they're multitasking the seriousness of the care they're providing while still engaging on a very fun, age appropriate level with each of their patients. And I was like, that is cool. I want to do that. And so
Mm.
I made that pivot. I was like, all right, I got to figure this out. What is it going to look like for me to go to nursing school? And I told my parents about it, and I think they were surprised and concerned. I think they weren't sure. It's my first time away from the home. Is this just kind of like a phase and blip, and
Mm.
she'll pass through it, or is this really what she wants to do? And their
Mm.
perception of nursing was just that it was a lot of physically hard work, right? Like it's labor, right? You have to pick up patients and clean up after them and all these things. And I think for them, they were like,
Right.
I don't know if that's, something she could sustain for a whole lifetime. And what's that look like? It was just kind of an unknown, right, for them. And so initially they weren't like thrilled with it, but they also, I think, were like, all right, we just got to trust her to figure out what she wants to do. And I was like, no, I'm going to do this. And so they were very supportive, even as I was kind of discovering that. And then, now when they see my career, I think they realize like, I didn't realize nursing was so broad and vast, and that they have all, and now like there are these opportunities that have been
Right.
available to me as a nurse. And
Mm-hmm.
so I think for them, it was just, they had no idea. And now they finally see, oh, wow, there's so much available to nurses. And I think they're very proud of that decision I made, because it's not what
Mm.
was on their roadmap. That's for sure.
Yeah. Yeah.
Yeah.
And they weren't wrong, because, I mean, it's the work of nurses that have gone before us who have paved the way so that nursing roles can evolve from just this task oriented work to now being like you in tech or being in leadership. So there are pathways that are opening up that weren't actually there before, but are now present. And there was some that were there, but people just didn't know about them, and it wasn't understood by the public. So really glad. I feel like your story and mine really mirror each other. Immigrant family. I also was an immigrant. I came here when I was 16, thereabout, after high school. And my story. I'm not going to go back and forth into it, but, also had that misperception, misunderstanding of who nurses were and what they could do and how vast and diverse our scope was. And so there was a lot of kind of pushback there. And then eventually we're like, all right, we'll just let her do her thing. And hopefully she'll come around to, figuring out whatever it is that she wants to do. But again, those same parents who may have had hesitation are now proud, are not the ones who are like, oh wow, I didn't know that all of this was possible. So that's an amazing story. And so you finished with your nursing degree. Did you go directly into pediatric nursing right after, or did you do other departments first?
Yeah, so I did primary care pediatrics first, but I was in a program where it was kind of like an accelerated bridge program where the first half of the program is kind of the BSN side of things, and they get you ready to take the NCLEX, and then the second part of the program is the MSN portion of it to become an NP. So I did that type of program like that, and so by the end, my first job was in that PNP role, pediatric nurse practitioner role in a primary care
Awesome.
setting. So yeah, that was my first job. I did that for a few years. Was really great. It was a nice way to just really round out everything you like very quickly learn in nursing school, especially about pediatrics, because
Yeah.
it's a lot to digest with the different age groups. And then I transitioned into specialty care at Children's National Hospital in DC, and I worked in the bone health program, which is a multidisciplinary program that works with genetics and endocrinology, and we also had some like joint clinics with the neuromuscular teams and the Crohn's and UC teams and things like that. So that was also a really, really fun job. Learned so much about rare diseases
Nice.
in that work. So yeah, that was really fun.
Yeah, I've had the most fun working as a pediatric nurse practitioner. Eventually transitioned to family, but I
Yeah.
mean, just in love with those children and their care. And people say, oh, it takes a special person to want to work with kids. And I'm like, no, it takes a special person to want to work with adults.
That's too funny.
I
Yeah.
mean, but thanks
Yeah.
for thinking we're special. I think that, there's just no way you can't fall in love with the children,
I know.
And so
Cute.
that has been, one of the greatest joys is being in the pediatric setting as a nurse and
Yeah.
then as a nurse practitioner. But let's talk about Pocket RN because you
Yeah.
transitioned into health tech and that wasn't something that you initially planned, right?
No.
So yeah, just tell me about how you decided to take that leap into tech and specifically Pocket RN.
Yeah. So another thing that wasn't on my roadmap, mostly just because I even had some limitations on my greater vision of what nursing could bring, what
Mm,
opportunity bring me. So it was not on my radar at all. We on a personal level, my husband and I were at a place where we had to make a move for his job out of the
mhm,
DC area, and
mm,
that was hard, right? Because I had really kind of found a community there. I had a job that had been there at that point probably almost 4 years, and so it was just very comfortable, and I knew my patients and the program and all this stuff, and so it made a lot of sense to stay. But the reality was that we had to decide, where we were going to live, and DC wasn't an option at that time. So, that's what landed us in Austin, Texas, and that's where we live today. But originally my goal was like, all right, we'll set roots here in Texas, and I'll kind of figure out. I'll keep teaching at the School of Nursing because I was teaching a lot of the virtual classes where the students are in their clinicals, and so
yeah.
they're taking these courses kind of a portion of it asynchronously and things like that. So I was like, I'll keep doing that until I figure out where I want to practice here in Texas. And that was my plan. And then through my husband's network, he went through a program called Breakline that helps veterans, people of color, and women transition into the tech world. So he was doing that as a veteran, and he was going through one of their programs, and it was really great for him. But through that network, they reached out and said, "Hey, I think your wife is a nurse, right?" And he was like, "Yeah, yeah." So they shared through their own kind of. There's a Stanford connection there
Mhm.
where Pocket RN kind of started. Found out that Pocket RN was looking for a director of nursing, and so they sent me the job description. I was reading through it. I was reading about the company, and it was a young startup, just got incorporated early that year. But I really resonated with the vision. Right, the founders were very clear in that they could see just the critical work that nurses were doing, and how, especially in the pandemic, you have this now opportunity to have nurses continue to show their expertise and provide the kind of level of coaching and education and care and continuity that is often missing in healthcare. And their whole goal kind of it was that tagline of like bridging the gap between home and healthcare. And I was
Yeah.
like, nurses are doing that all the time. And
Yeah.
here's a company that acknowledges that and also wants to highlight and value that role of the nurse. And so it was a no-brainer to join the company, even though it was not at all in my plans.
Right.
And so, yeah, that was 2021. So I've been there for about 4 years now, and it's been an incredible journey. So much fun to be a
Yes.
part of that team. So,
That's
yeah,
so wonderful. And let's talk about what Pocket RN is, right?
hmm
Because I know your tagline is your nurse for life.
exactly.
Can you just explain to my listeners how the platform works exactly and
Yes.
how it is actually helping bridge the gaps between, health and healthcare? Just give us like a summary.
Sure. Yeah. So Pocket RN is a virtual nursing platform and service. So yes, there's an actual platform that does the matchmaking of nurses to patients and things like that to make sure they're
Mhm.
in the right specialty and that they have the right training and of course the licensure and things like that. But beyond that, it is what we call kind of like a new nurse-led care delivery model. And so basically what we talk about is that tagline for Nurse for Life is that, if you have a nurse in your family, whether it's a friend, family member, neighbor, it's that person you turn to for like everything, right? Like
Yeah.
something's wrong
Yeah.
with your family member.
There
You're
you
like,
go to.
you text them, you send them
Mhm.
photos of the rash on your child, or
Mhm.
it's that person you turn to when you want advice on like what do we do,
Yeah.
what should we expect, who do we what specialist should we ask for, is this a normal progression, do you agree with what the doctors are recommending for my mother, like
Yeah.
you go to that person for that. And so the vision for Pocket RN is how do we democratize that, like how do we
Mm.
offer that nurse for life for anyone who doesn't have that in their in their network. And also sometimes, you don't also want to keep bothering the same person in your family
Right.
or friend
Right.
group about it. And so, yeah, that's kind of the vision for Pocket RN in terms of being able to walk with patients and their families
Yeah.
through all these different care transitions. And what we found is, we have partnerships kind of across the board in terms of from large academic medical centers to federally qualified healthcare centers to
Mhm.
non-medical home care, and more. And the most exciting thing for us that we're getting ready to launch this summer is the GUIDE program, which is
Yes.
a Medicare-based a dementia program that helps provide services to patients, and especially the focus for this one are the caregivers, right? So
Mm.
caregivers are the ones who are often the most burdened with trying to navigate our very complex health system while also navigating all the changes that are happening with their loved ones at home. And, dementia has so many there's different types. And then even the progression of disease is so different for each individual. And so
Yeah.
having a nurse who has seen that and can walk you through as a family on like, how do you manage these changes that you're seeing with their loved ones? What do you do when they start not recognizing people, all those different things that are not only so heartbreaking, but also just confusing for the families. And they don't know how to best to love them and care for them and support them. And they're having to do this all day. Right. And so we're really excited because the guide model is really a way to it is our nurse for life model, like in real life. Right. And so we're
Yeah.
really excited to be able to launch that and provide that kind of support for patients and families. So
That's so interesting to see how nursing is evolving with technology and all
yeah,
the diverse roles that nurses can now step into, and
exactly.
these upcoming trends that are super exciting, not just for nurses, but for the healthcare of people who
Mhm.
ordinarily may not have that access. It's like having a
Exactly.
best friend that's a nurse.
Yeah.
That's
Yeah.
the way I think
Exactly.
about it. And you can always like send your questions in and
Yeah.
have somebody respond to you. What an innovative concept. And so how did you transition? Because I know that there were some challenges, I'm sure,
Mhm.
going into a tech space where you're not directly
Sure.
patient facing. Were there some
Mhm.
challenges that you faced in stepping into that new role?
I think the first challenge was really a little bit of that imposter syndrome of like, I'm not a tech person, right? And like, am I the right person for this role? Am I going to say the right things? Am I going to provide enough perspective? Like, am I going to be able to be the person that they want me to be in this role, right? And so there was definitely a lot of that up front. I was lucky enough that the Pocket RN culture is very warm and welcoming, but also just values everybody's input. And so it was a very safe environment to walk into. And I learned very quickly that I could kind of squash that voice in my head and just focus on what I brought to the table. And
Absolutely.
I think, yeah, nurses, it's like I see, and I continue to meet so many nurses that wonder the exact same thing, because they're like, oh, I'm good at patient care. I don't really know what that translates into, but it translates into so many things. And so the things that I did as a nurse working at a large health system, trying to grow an infusion program and dealing with some of the challenges of just building that up, were just real life skills that I was able to transfer into my role at Pocket RN, to be able to think about things from an operational perspective, to think about things in terms of a patient experience perspective. And then there are things we take for granted that product teams and technology teams may not understand about the patient experience or their expectations. And so sometimes my perspective can be helpful in even developing how the user interface is on our platform, right? When they're developing a new feature, I'll say, hey, like the nurses aren't going to really like it if they're going to have to look for it here, here, and here. Is there any way we can make it flow a little easier? Or from the patient side, we're working with a lot of geriatric patients. Like they're not going to, I don't know if they're going to know that button you guys have here on the design is actually like a slider. It kind of looks like you can click it, you know, like simple things like that, just from being with patients and families, you start to learn. And so, yeah, that was definitely one of the first initial challenges, but I realized it was more like in my head. I had to kind of get over that and give myself credit for the value that I could bring to the table. So.
That's wonderful. So say I'm a patient, I'm needing questions answered. What do I do? Do I just go to the Pocket RN website and click on the contact a nurse button? And then what do I expect to happen from that point forward? And how does it tie in with my insurance or out of pocket costs? Like what does it actually look like day to day?
Yeah. So in terms of how to access the care, we make it really easy because most of our patients are the aging and elderly, right? And so there are a couple different ways you can access care. You can log into the app and log into your profile and meet with the nurse that way. But we also have a wonderful support team. They're really awesome that you can just contact, whether on the phone or via text message, and they can also help facilitate getting you on a meeting, either right now if you need it on demand or scheduling ahead of time. If you have a nurse that's your nurse for life that you're used to meeting with, you can schedule those visits with them as well. So in terms of the actual like receiving care as a patient, it's pretty easy. We make it so that you can kind of access it a few different ways. The other thing I really love about it is that we also have caregiver profiles, because sometimes the person who's really driving the care and making sure their loved one shows up to appointments is a spouse or an adult child or something like that. So we create those caregiver profiles, so that they can schedule on behalf of the patient, or they can, initiate and start a visit on behalf of the patient. So that's another option as well. And then in terms of your question about kind of how does it get paid for and things like that. So it really depends on, we have partners across the country. So it kind of depends on what service you're kind of a part of, right? So for some of our like hospital-based programs where we're providing support when they're transitioning, like post-discharge and, they're high risk for readmissions and things like that. The patient is not the one who's being charged for that. It's like it's a program that the system has actually contracted us to provide. So in that situation, they don't have to worry about their copays or anything like that. In programs like Guide or other things like chronic care management, it's kind of based on their insurance. They enroll and consent into the program and things. They have to be eligible and things like that. So they're different codes. But I think the reality is that these nurse-led services is that there aren't a ton of options available in kind of the traditional way that you bill for services that we currently see in healthcare. So that kind of segues nicely into the work that I'm doing with the Commission for Nurse Reimbursement. Is that
for sure. So, I wanted to go into that. But real quick, I wanted to just make a note that this does not replace your primary care provider, correct?
Exactly. Yes. So we are like a glue between those things, right? So you still need your primary care provider, you still need your specialists and things like that. But we know that so much of healthcare happens in between those visits,
Yeah.
right? And
Yeah.
sometimes you need someone who's a bit of a quarterback, connecting
Yes.
those dots, making sure those
Yes.
different providers are communicating, making sure they're up to date on things that they might not be aware of or side effects that they might be having to one of the new prescriptions. And so, yeah, that's kind of how we don't replace any of that kind of
Yeah.
traditional like
Yeah.
healthcare services that they should be receiving, but we are kind of that extra person to be in their court to make sure that they're, getting all the care that they're supposed to get and that they're
Yeah.
following along with the treatment plans that they have as well. So
Absolutely. And maybe you guys will expand one day and have like a pocket NP or something. And
yeah.
then
I know. I've gotten some requests for pocket NP, pocket PA, things like that. Yeah.
That's awesome. Okay, so let's talk about the Commission for Nurse Reimbursement. Can you tell us what it is and your particular involvement as the co-chair?
Yes. So the Commission for Nurse Reimbursement, it's an important initiative. It's, really just like a coalition of people across the healthcare industry who are leaders in their own right in different areas of healthcare, because I think we all acknowledge that the way that nurses are considered when you're looking at the books of any hospital system or organization is pretty outdated. And this is something that more and more people are paying attention to now. And I think it's also a really complex issue, right? It's not something that's going to be solved overnight. I also don't think it's a one size fits all thing either, because as you look at the whole healthcare continuum, the role of the nurse is a little bit different, just like we talked about. And so what that reimbursement model could look like might change. But there are several commissioners on the team that also have done a lot of research in this space to kind of understand what are our options here. And in the membership community is a broader group of people who are just wanting to learn more about how does this work? Like, let me understand the history of how nurses were paid for their services, how it's evolved. And then with, for example, the newest fellowship that was just launched, it was like, it's more of a deeper dive into, what options are available? What are the different models that people are exploring and considering? What are the ramifications of going that way, right? Because again, healthcare is very complicated. There's a lot of stakeholders, lots of moving parts. And so I think for me, what I admire and I'm excited about with the commission is that it's just a meeting of the minds of people who want to learn more, really explore those options, raise awareness, and continue to push forward so that we don't just kind of accept the status quo, right? Because we know it's not working when you look at kind of the burnout and turnover and frustration that you'll often see with nurses who are frontline. So yeah, it's an exciting group. I'm excited to be a part of it. And really, I'm learning as being a participant, to be honest. And that's the best kind of place to be for me. It's like, I want to be on the forefront of understanding the complexities of these issues and different avenues we could take, whether it's more of a political advocacy route or whether it's more academic and providing more research and data on outcomes of when nurses are more involved. There's so many different ways to kind of to look at the issue, and it's exciting to be a part of a group that's very forward thinking and wanting to move this conversation forward. So
And you talked about how nurses have been traditionally kind of reimbursed and being tied in with the room rate, if you will. Why is it important that we are separated and break away from the room rate and be compensated or reimbursed as healthcare professionals separate from the IV drips and the bed and, and the admissions and everything else?
Yeah. So I'll speak to probably the area that I'm most familiar with. So if I look like at primary care, for example, when you have freestanding primary care clinics, it's really hard for them to be in business these days, right? But if you think and you just look at what the RNs do, there's so much that they do with their time that have true impacts on patient outcomes, but there's no like code or service or anything that you can bill for it. And so basically when you look at a small practice, it's like they're trying to see like, how do I get the most out of this line item, right? Like I have to pay for this nurse's time, but it's kind of their own choice, right? And you see other situations where they try to figure out how can I pay less for this, right? But then the nurses are asked to do more and more, right? And so from preparing the vaccines and all the things that are kind of the typical care delivery side of things, but then also the whole aspect of the teaching and things like that. And obviously there are some like lower level codes that can be billed for when a nurse is doing like a skin read, like PPD reading and things like that. But I think the reality is that if nurses were able to have a more sustainable structure for them to spend more time with patients, and we could actually provide preventative care rather than reactive care, we're already testing this out at Pocket RN. When you have that kind of one-on-one focused time to provide education and teaching on someone's conditions, I have seen on Pocket RN patients who are part of just regular primary care who have heart disease, and you ask them, like, again, someone's taught them about a low sodium diet, but you ask them again, is it Pocket RN nurse? And they're like, no, I don't really know what that means. And then you're like, well, I'm sure someone's talked to you about it. They're like, well, I don't really remember. And you realize when you see what they're eating that they don't remember because they're not applying those principles to their daily life, right? They're not aware of the sodium that's hiding in the different condiments that they're putting on all their food and stuff like that. And so it takes that time of someone sitting there and really unpacking their life and asking the right questions and then providing some coaching and plans, alternatives, all these other things. This is just one example where like when nurses have that dedicated time to help provide that teaching, that we could start to see like downstream effects on the patient's outcomes, right? And we're just not good at that in the US. That preventative care is really not that preventative, seeing your primary care once a year, doing a slew of labs, and doing a quick check on your reflexes is not really enough to keep our country healthy, right? So
And so what I'm hearing you say, if I can reiterate, is that preventative care is not incentivized for nurses because we, first of all, don't have all the time in the world. And second of all, the reimbursement just doesn't justify the time, right?
Yeah.
There's a lot of patient volume and not enough time to provide that care. But if we were giving that protected space, making sure that we can teach patients properly and allow them to be proactive about their care, teach them how to read food labels, teach them that just because something says 100 calories, they need to be looking at each and every content and component of that food, teaching them what is hiding in their foods that they're not aware of. Like those things will eventually lead to patients being healthier, needing to be readmitted into the hospital, and really just taking charge of their health and being accountable. That's what I'm hearing as it relates to the reimbursement structure.
Yeah. And that's just my perspective from like what I've seen in primary care. I'm sure a lot of nurses have seen patients like once they're at a position where they have all these comorbid chronic conditions and they're hospitalized for complications. And that's when they receive their discharge teaching on everything. I've seen a lot of patients say, oh, I didn't realize diabetes could do this. I didn't know I could lose my foot, right? Like all these things that they just didn't realize. And I think, our primary care services, if we had some structure to provide better teaching and education, even at an early age. And that's what I tried to do in primary care with my pediatric patients. I would try to teach them like, have you seen adults that have this problem? Do you know what you could do to help maybe prevent that so that you don't have to have the same conditions that your grandma has and things like that. And providing that education early on and empowering them to make good choices that can help mitigate some of those risks, I think is something we just don't have enough time for in primary care today.
Yeah,
so
it's crazy. 15 minutes is not enough. I mean, it took us 15 minutes just to catch up before we started filming.
I know, exactly.
And we weren't even done. We had to cut it short.
Yeah, exactly.
Yeah. So, but yeah, I appreciate you sharing that and your work with the Nurse Commission for Nurse Reimbursement. And again, like you said, the blending of minds of people who are forward thinking and really want something better for the profession of nursing and envision something better for the profession of nursing and know that it's possible and actually dare to put their hands to work to see it come to life is really admirable. So I applaud you. I applaud all. I know Rebecca Love is part of the commission. Melissa Mills is part of the commission. Really proud of that work. Okay, so we are going to really transition into our media portion of the podcast. But right before I go into that, I just wanted to ask you, what are you most excited about when it comes to nursing, especially now in this tech space?
So I think the most exciting thing for me is that I think there's more awareness that there are more options, right? Even just for the nursing community. You see so many more Instagram influencers or profiles that are focusing on the different places your nursing career can take you. So I think that's very exciting. And I love to be a part of that, at Pocket RN. Being able to offer a more flexible option for a lot of our nurses to work from home. They really get to enjoy still using like their nursing chops, right? Like all that expertise and knowledge that they have from working at the bedside or different specialties for a while, and being able to still bring that value to patients, but then being able to do that comfortably from home is something that I always get really excited about, to offer that opportunity. So
that's wonderful. Your parents must be so proud now.
I hope so.
They're like, yes, we're not lifting anyone.
I know, Mom and Dad, if you're out there, I hope you're proud of me.
Yeah, I mean, because, we talked about your Korean ancestry and just how those cultural influences can really shape the way that we view our profession and advocate for yourself, right?
Yes.
Thank you for sharing about the evolution of our profession and how things have really opened up and different opportunities and pathways have opened up. All right, so let's talk media, right? Do you watch any shows? I know you're a busy woman, but if you've seen any shows in the past, or TV, or just however you feel nurses are portrayed, can you talk a little bit about that?
Sure. So I would say that I think one thing that I'm excited about is I do think there's obviously some room to grow, but I do think the narrative is improving in our favor, right? My husband is probably more of a TV binge watcher than I am. So I feel like I just by proxy end up kind of watching what he's watching. But there was a time where he would watch that show House, right?
Yeah.
And it's a very interesting show. Like they feature a lot of like zebras, like cases, the very rare. But then in that show, the doctors are doing everything. Like they're in the lab testing the specimens. They're in the homes getting like forensic evidence on things. And I'm like, this is very unrealistic. Where are the nurses?
No, Dr. House would say, I don't trust nurses to do anything. Like there was an episode where he said that, like, is this all the nurses do? And the other physician was like, I don't think Dr. House trusts them to do anything else, or something like that. But go ahead.
Yeah, so that's kind of,
show.
That's, but it's an older show, right? So I feel like that things have evolved. And then, more recently, there's another show that I didn't get to see all of it, but I know I got to see like one of the first initial seasons. It was like The Resident. And the main characters is a nurse practitioner. And I was like, oh, finally.
Yeah, finally.
They have someone who's like actually
smart, and she is, she's quick. I love her.
Exactly. Yeah. So I think that was helpful, just to be able to see a little bit more representation of like the different types of nursing, right? And so that was really helpful to just see that progression. But again, I think there's definitely room for improvement. Even in that show, they could probably highlight a bit more of what a nurse practitioner can do, in that space. But it's still improvement over time for sure.
Absolutely. So. Thank you. All right, let's play our game. We have 5 minutes to go, so I'm going to shake my jar, Mirini. I know you know the game already, so let me shake it and pick your category. Make it a fun one.
See what we get.
I hope I pick like K-drama or something.
You're such a K-drama fan. Yes, I know. I've heard this. Fan. Yes.
Okay, well, it's not K-drama, but it is drama.
Drama. Okay. Yes, drama. It's a good one.
Okay, go ahead. Take it away.
Oh, so I forgot what I'm supposed to do with the part of it.
So basically, you're supposed to come up with the plot line for a show that features a nurse character or a nurse in the lead, and based on this category, drama. So
sure.
Yeah.
All right. Sounds good. Okay. I'm ready. So I would say in this plot with a nurse as kind of the protagonist and in the drama theme, one thing that I'm always learning about is just, even from the nurses I work with, is just how much they show up for everybody in their life. So I think in this, in this drama, you would just be able to see like the full picture of this one nurse and how much that they're constantly giving themselves to others, right? So, I've met so many women over the years who are either in that sandwich generation of like, they have their kids they're taking care of, they have that relationship with their significant other, they have their aging parents, and they're trying to balance all of that, right? And then they go to their workplace as a nurse, and they're dealing with all of the things that their patients are coming to them with, right? And they're not only just checking off the blocks and making sure, here's your medication and, here's my documentation, but they're asking questions and realizing like, oh, is my patient, do they have a home to go to when they get discharged? Or, they're taking on the full picture of that patient as well. Are they in a unsafe situation at home? Nurses are constantly picking up on those things and advocating for their patients, and sometimes even carrying a little bit of what they're doing every day, right? What their patients are facing every day, right? They've got that like empathy that is hard to teach. It just kind of comes naturally of being someone who wants to take care of someone. And so in the drama, we have to add some love to it, right? Some love stories. So I'd say, and I was like, I'm going to shout out to my husband. I think he is someone who we're going to have someone mirrored after his role, someone who's like finally partnering to that person and like taking care of her, right? Like that person is always taking care of everyone else, but then finding someone who sees that in them and is able to be like, let me take care of you the way that you take care of everybody else. So that would probably be
that is K-drama. Are you kidding me? I watched this K-drama in April because that was like my month of rest. It was called When Life Gives You Tangerines.
Oh, my mom's watching that right now. I haven't seen it yet. She says she just keeps crying.
Yeah, it's a tearjerker, but it's literally what you're explaining. She's not a nurse, but she has a husband who literally just worships her, takes care of her like a little baby. And she's like a spoiled little brat. She was spoiled by her mom, and now her husband is like spoiling her even more. But it's a sweet, sweet story, and it's so very well done. Even my husband was like, "This is so well. I mean, this is well done." He doesn't even really pay attention to these shows, but he was like, "It feels homegrown. Like it feels like you're in the story with them." And you should totally watch it when you.
I have to watch. I keep hearing about how good it is, so it's on my must-watch list now.
It's really wonderful. So but thank you. That was wonderful. I would watch that show if you ever produced it.
I love that.
Thank you so much for being my guest. Can you tell people where they can find you to follow along or follow Pocket RN?
Yes. So I'm on LinkedIn. Pocket RN is on LinkedIn, and it's probably the best channel for us. We're posting a lot about kind of when we're hiring for new nurses, which we will, in this coming year, I think we'll see a lot of growth at the company as well. But then also we post a lot of updates about how we're doing with our guide program. And we like to also highlight patient stories, nurse stories, things like that, just because it brings us back to the roots of like, why are we doing what we're doing? And so I love those reminders. So LinkedIn's a great place to find me, but also follow the Pocket RN journey as well. And the Commission for Nurse Reimbursement also very present on LinkedIn. So it's a good way to stay on top of the things that are happening with the fellowship and legislative events and things like that. So
awesome. And last question, if you could recommend someone to be a guest on the show, who would it be?
Ooh, that's a good, like a real life or more like a fantasy one?
No, real life.
Like a celebrity that we can say like, here, come talk to us about nursing.
No, a real life person.
That's a good question. So I have someone who I worked with for a while. So back at Children's National, I used to work with her. She's a fabulous nurse. Her name's Maria. And she's one of those people who have always been just really calm, but then have a really good sense of what everyone needs and how to keep things moving in the clinic. And then over the years, she's kind of, progressed in her career in more of like nursing leadership. And right now she's working on, she's like the director of nursing excellence at Joe DiMaggio Children's Hospital. And so she's kind of been, she is part of kind of their response to their magnet programs. But aside from just that, also how to support their nursing workforce. And she is just a really great soul. So I think she would be a great person to interview. She's smart, she's sweet and compassionate, and she's doing a lot of fun things. So
awesome. What's Maria's last name?
Paniotu. I will send it to you. Paniotu is her last name.
Okay.
Yeah.
Sounds perfect. Thank you so much for being my guest today. Guys, thank you for joining and tuning into today's episode. Thank you again to Mirini. You've been such an amazing, amazing guest. Guys, please remember to like, to share, and to subscribe. Let's keep leading. Let's keep advocating. Together we can change the narrative of nursing. Until next time. Bye-bye.
Bye. Thank you.
Thanks for hanging with me till the end. I hope you gained some valuable insight into the world of nursing. If today's episode inspired you, please like, subscribe, and share with someone who needs to hear about the amazing work nurses are doing. Let's keep breaking stereotypes and reshaping the narrative together. I'll see you next time.